Monitoring the safety of regulated products is a major part of FDA's mission to protect public health. Post-market surveillance is the process by which a drug's safety is monitored on an ongoing basis after a drug is approved by FDA. Post-market surveillance seeks to identify problems that were not necessarily observed or recognized before approval, and any problems that might arise because a drug might not be used as described in the drug labeling, or because a drug is being manufactured incorrectly. The FDA Adverse Event Reporting System, or FAERS, is a computerized database containing reports of adverse events. It supports FDA's post-market safety surveillance program for all approved drugs and therapeutic biologics. MedWatch is FDA's safety information and adverse event reporting program. It provides important and timely medical information to public healthcare professionals, including information on FDA-regulated products. Healthcare professionals and consumers can also report problems they suspect are related to certain FDA-regulated products using MedWatch. FDA has established teams responsible for post-market drug safety surveillance. For example, our safety evaluators detect and assess safety signals for marketed drug products. They work closely with the review division medical reviewers who reviewed the products initially, so that potential safety signals are placed in the context of existing preclinical, clinical, or pharmacologic knowledge of the drug in question. Our epidemiologists evaluate data generated from various post-market surveillance tools. They estimate the public health impact of safety signals by evaluating computerized databases and even the published literature. One of the improvements to FDA's drug safety surveillance program was born from the FDA Amendments Act. This act calls for the creation of an active as opposed to the passive nature of our adverse event reporting system, MedWatch. This is called the Sentinel Initiative, which aims to develop and implement a proactive system that complements existing systems that the agency has in place to track reports of adverse events linked to the use of its regulated products. This allows evaluators to data mine. That means extract meaningful, organized information from large, complex databases. Data collected from suspected drug-related adverse event reports and other electronic medical information aids in identifying signals of adverse events and the patterns in which they may occur. Development of this tool holds great promise as a way to optimize our resources here at FDA.